Hello, this is Alice Shapiro, your instructor for HIT 154, and this is the screencast PowerPoint for diseases of the endocrine system. I'm just going to really emphasize diabetes. There are other diseases of the endocrine system which some of you are going to report on for your wiki project and or for your term paper. However, I feel very strongly about the epidemic proportions of especially young people, quite young people in our country who are developing type 2 diabetes, which used to be called adult onset and no longer can be called that. So I'm just going to emphasize that. Upon completion of this unit, as you can see, you will be able to define basic terminology, describe the key characteristics of diseases of the endocrine system, and understand etiology, signs and symptoms, diagnostic tests, and possible treatments for selected diseases, and understand the difference between type 1 and type 2 diabetes, and explain some possible causes for the increase in type 2 diabetes in young children. As I said, it is epidemic in our country. The diabetes involves the pancreas, and please review if you've forgotten the anatomy and location of the pancreas. Please do review that. It is located along the lower curvature of the stomach, and it is the only organ, it's quite unique, the only organ in the body that has both endocrine and exocrine functions. The exocrine portion releases digestive enzymes through the pancreatic duct into the duodenum of the small intestines. The endocrine section of the pancreas, which is the islets of Langerhans, produce insulin and glucagon. Insulin is produced by the islet cells, and it stimulates cells of the body to take in glucose from the bloodstream. So in other words, when serum glucose is high, insulin will be activated to allow glucose to facilitate the movement of glucose from the bloodstream into the cells. And of course, in the cells, the glucose will be used for energy to conduct the work of the cells. Loss of insulin results in diabetes mellitus and hyperglycemia. And hyperglycemia simply means hyper, above, which is a high blood sugar level. Diabetes mellitus literally means sugar siphon, and the way this disease was first diagnosed was that people, and this was back in Roman and even before that in Greek times, physicians would notice that people were wasting away even though they were consuming food, and they did different kinds of lab tests back then rather than the types of lab chemical analyses we have now. They had visual, olfactory, and even sensation of taste that was utilized to diagnose conditions. So diabetes mellitus, they were aware that sugar was being siphoned off of the body. If there is overproduction of insulin, then a person will be suffering from hypoglycemia or a low blood sugar level. Here is how blood glucose level is controlled. Please take time to take a look at that. If there is high blood glucose, beta cells will be stimulated in the pancreas to produce insulin. Then glucose will enter cells from the blood and blood glucose levels will be lowered. If there is low blood glucose, then alpha cells, also in the islets of Langerhans of the pancreas, will be stimulated to produce glucagon, and this will stimulate the liver to release glucose from glycogen, which is stored in the liver, and then blood glucose levels will be elevated. The endocrine function of the pancreas is to control the glucose levels in the blood. And as I mentioned, it is controlled by the secretion of the two hormones, insulin and glucagon. And you can read this over and take a look at this. I'll give you some time to look at this by reading it to you, even though I know that you can read. Insulin is secreted by beta cells, which are specific cells in the pancreas, located in patches of tissue named the islets of Langerhans, or sometimes referred to just as the pancreatic islets. Insulin, as I mentioned, lowers serum glucose and facilitates the entrance of glucose into the cells, where it is primarily stored as glycogen and metabolized for energy. Glucose enters primarily skeletal muscle cells and fat cells, but it can be utilized by all cells of our body, and particularly glucose is needed as the prime source of energy. It is stored in liver and skeletal muscle and fat, but it is utilized by the nervous system cells. Neurons can only really effectively use glucose for their source of energy. So if you have low serum glucose, low glucose levels, you definitely will experience dizziness because your brain is not receiving the fuel that it needs. Glucagon is secreted by alpha cells of the islets, and when level of blood glucose falls below normal, glucagon is released and it circulates to the liver, stimulates the release of glucose from its storage form, which is glycogen. As you study diabetes, think about why type 2 is increasing in children in the United States. And this may also allow you to go back and think about some of the things you learned in the last section, which was diseases related to environment and diseases related to nutrition. I'm sorry that this slide is a little bit blurry, but I wanted to blow it up anyway to give you the idea. Children are beginning, unfortunately, to resemble more and more the young boy depicted on the right-hand side of this slide. All right, two types of diabetes. Type 1 is actual destruction of the islet cells. When a person fails to produce an adequate amount of insulin, sometimes no insulin virtually at all, this person, of course, must take insulin injections to replace the insulin that the pancreas is not able to produce. It is called insulin-dependent diabetes mellitus. This type used to be called childhood onset diabetes, but now we call it type 1 diabetes mellitus. We're not sure of the cause. It may be related to autoimmune effects. It may be an autoimmune disease. It is likely an autoimmune disease. In type 2 diabetes, a person does make a sufficient amount of insulin, but it has lost its ability to influence the cells of the body. And it can be treated by diet, exercise, and oral medications. Although for many people with type 2 diabetes, when oral medications do not work or when they have not been able to lose weight, and oral medications, as I said, are no longer effective, they may have to take insulin. So although it is called non-insulin dependent diabetes mellitus, there are people with type 2 diabetes who do need to inject themselves with insulin. Why is insulin only injected? This is because insulin is a protein. If you took it as a pill, your body would digest it, your digestive tract would digest it and break it down to its component amino acids. It would no longer be insulin and no longer effective for controlling blood sugar levels. So a person with diabetes type 2 is first attempts to be treated by diet, exercise, and oral medications if needed. Symptoms are polyuria, caused by excessive filtration of glucose into the kidney tubule and the volume of water required to carry it away. So this is a diuretic effect of glucose. Glucosuria and polydipsia. If you have forgotten what these terms mean, this is important for you to review these. In the absence of glucose, cells metabolize fats first and then proteins. Because glucose cannot enter the cells without the action of insulin, the diabetic metabolizes a large amount of fat. Fat metabolism produces a large number of fatty acid, ketone bodies, acetone, and related substances. And this production of acid lowers the body's pH and results in a condition called acidosis. The normal pH range of our bodies is 7.35 to 7.45, which is slightly in the basic range. Neutral is 7.0. Anything below 7.0 is acidic. Coma and death can result with a pH below 6.9 or below, even slightly below 7.0. Weight loss and fatigue due to metabolism of fat and protein do occur. Fat and protein are being metabolized for energy because glucose is virtually not available. It's being urinated out. Complications, atherosclerosis, and then a blockage of the coronary artery could cause a myocardial infarction. Thromboembolic strokes. This is when a clot breaks loose and can clog an artery leading to the brain. Occlusion of a leg artery can result in gangrene. Poor circulation. Diabetic retinopathy, which can lead to blindness. Neuropathy, in which peripheral neuropathy, in which feelings in the periphery, particularly the legs, the lower legs, does not exist. So sensations are not received or perceived. And renal failure because of the stress of all of the filtration and the excess load from glucose being in the bloodstream rather than being taken up by cells. Treatment, regulation of diet, exercise, insulin, regulation of the proper insulin dosage is a very personalized issue for people who are on insulin. Oral medications are used for type 2 diabetics. They do not work for type 1 who cannot produce insulin. These are agents that are supposed to stimulate the secretion of insulin from the beta cells, which still do have some capacity, but once that capacity is further diminished, then insulin may be needed, as I said, even by type 2 diabetics. A diabetic coma can result from acidosis and dehydration. And here are the symptoms: deep labored breathing, acidosis, fruity breath, dry mouth, flushed and dry skin. Treatment requires urgent replacement of fluids. Insulin can be given intravenously, and this also may help. Insulin shock results from too much insulin, and in that case, blood sugar level must be raised, and perhaps intravenous injections of glucose might be needed. Epinephrine can also help to raise blood sugar levels. Tests, urine tests for ketones, fasting blood glucose levels, glucose tolerance tests, and so forth. And the glucose tolerance test challenges the ability of the body to secrete and use insulin. And it is formed by having people take standard doses of glucose at various times after a 10-hour fast, and to see how the body actually is able to take up the glucose and whether or not the glucose is excreted in the urine, and so forth. The glycosylated hemoglobin determination is a simple blood test for long-term control, or for how your body is processing the glucose for long-term. So that's another test that can be done. Here are some warning signs and symptoms. And then there are a number of films, 3 films on your Moodle page that refer to diabetes. So please go there and have a look. Okay, so I hope this was helpful for you. As I said, there are of course, other endocrine diseases, but I wanted to emphasize diabetes for reasons that I mentioned before. Have happy studying, and I will be in touch with you soon.